Hey, this is Dr. Corey Glenn with Blue Sky Bio, and in this video I'm going to show how to do a true crown down implant planning. So if you've used Blue Sky Plan for any length of time, you know that there's always been library teeth, so that if you wanted to fill in an edentulous spot, you could grab a library tooth, stick it in there, stretch it to fit the space, and that was very helpful in doing your implant planning. However, you didn't have much option to alter the occlusion, to change the shape of the tooth. And there are cases where you're going to need to do a more formal planning. You're going to need a true CAD proposal with the teeth in the ideal occlusion and position and aesthetics and all of those things. A typical case might be patient is missing numbers 7 through 10. Well, you could throw some library teeth in there and it'll be close, but you really, when you're trying to plan as precise as you need to for an anterior aesthetic case, it's more ideal if you'll go ahead and do the true full crown design with the ideal occlusion, ideal gingival borders, and ideal contours to the teeth, and then plan your implants from that. So this is really an easy case that doesn't justify that, but it'll be good for demonstrating this. So we're in Blue Sky Plan, and the first thing I'm going to do is just launch the surgical guide module. Now, even though this is a 1 or a 2 implant case, I'm not going to choose that option. Rather, I'm going to choose to open the patient CT scan. If you choose this option, it's going to go into the wizard, which the wizard currently does not do the full crown design. It's just going to be a library tooth. So let's grab the patient CT scan. Okay, so the CT is opened now, and you'll have a box up here that prompts you to import the STL. And this is a good time to do a quick aside. These are the STLs for that case. Now, obviously, if you're going to design the opposing occlusion, you need both upper and lower models. You could get away with just making a guide with just the arch you're working on, but again, if you're going to design the full crown, you need to know where to build the occlusion of this missing tooth against this. And so you will need to get upper and lower models. And when you scan these, whether it's an intraoral scanner or if you're scanning some models, you need to go ahead and have these things saved in occlusion relative to one another. Now, these are not oriented correctly to the data in Blue Sky Plan, but I'll show you how we do that. But the main point is that you do want upper and lower scans, and you want them oriented in occlusion. And that should be done automatically by most scanners that are on the market. So back to our case, let's go ahead and hit Import STL. And since the site that we're working on is a maxillary site, let's go ahead and import the maxillary scan. This is the auto stitch function. We just need to tell it which jaw we're working on, so go ahead and click OK. And this should be a really difficult stitch. Do you notice all this scatter? We'll see how the software does with automatically stitching that. All right, so let's verify this. I trust the auto stitch function, but we always want to verify it. And so I'll do that for starters in the axial window. I like to turn those projections off and just scroll up through the arch and see that it's tightly adapted. Now, you can see somewhat that this is it does appear to be well adapted, especially on these incisal edges. Those generally show up the best. Or even if it's like a PFM crown, the ceramic oftentimes will show up really nice, like you see here. And it's only once you get down into the metal that you have all this scatter. So that looks really good. I'm happy with that. Let's also look in the cross-sectional window and scroll through it. And once again, we see that tight adaptation. And this was also a good scan because you notice how they've got all this airspace. Try to keep your patient from putting their tongue on the top of their mouth and maybe even stuff some cotton in the vestibules and in the palate. Because when you do that, you can see this black airspace and you can see how well that coincides to the tissue model. This transition from air over to tissue is going to go from black over to gray, and that's a helpful tip in stitching these high scatter cases. So we have our STL. It's stitched in place to the DICOM data, and I'm going to go ahead and turn off the DICOM data. Now, let's imagine what would happen if we go ahead and just import another STL, this time of the lower. Well, it's going to ask you to do the auto stitch, and it's going to stitch it to this lower. But the problem with most tooth-borne CTs is that they are taken in an open bite. So if we just bring it in and stitch it to the lower, that's not going to be where we want it. We want to bring it back into its original relationship with this model. So let me show you how we would do that. Let's go up to File, Import STL. And this time we're going to get the mandibular scan and go ahead and click OK. Now this is going to come up because again it thinks you want to stitch to that, but we do not. We want to X out of this. And when we do that, you're going to see that it brings in the STL, but it's way out of position because remember, it's still in the same orientation that it was from the intraoral scanner that was used here. So how can we restore it back to this? If you'll come over in Model Editing module to Model Manipulation, then you can align the second scan, the one that's not stitched yet. Choose that in the drop-down menu here. It's going to be a mandible. And we don't want to stitch to the CT, we want to stitch to a model. And so go ahead and click this button. And what is the destination that you want to stitch it to? We want to stitch it back to the maxillary cast. And here we do not want to use points. If you choose this option and uncheck the points, then all it's going to do is say, okay, before we imported this STL, it was in such and such position relative to this. And now if we change one, it's going to just restore that relationship back, but it's going to pull the mandibular to the destination model to reestablish their original relationship. So we'll click OK, and you'll see it happen immediately. And now we have upper and lower models that are in occlusion. The maxillary model stitched to the upper arch, but the mandibular model is definitely not stitched to the lower arch. Okay, you can see that very clearly here. Rather than stitching to the CT data, which was in an open bite, now we have this in its normal occlusion. So with that done, we're ready to go ahead and design the crown. Okay, so this is why you don't want to work in the wizard because you're going to be jumping around in modules. So let's go up here to the top in the corner and change from model editing over to crown and bridge. All right, so this is the crown and bridge module. And we're going to have to open up some of the panels because only the teeth surfaces panels are showing right now. So come up to panels, and we're going to want the teeth editing panel, and we're also going to want to open the restoration design panel. And it will tab all of those over here. Okay, so I'm going to hide this mandibular model for the moment. And with that done, we can come up here to the Add Tooth button. And you'll choose your library that you want to take a tooth from. I like the Mitchhurst Flat Anatomy Library for this particular dentition. We're going to choose that second molar that's missing up here where the implant will be placed, and then click OK. And this should be ready to drop as soon as you hold down Shift and click on the model. Okay, so it's dropped roughly into position, and now we need to manipulate it around. Okay, we're not worried much about occlusion and all that stuff right now. We're more concerned with just general tooth placement. So you see here that you've got an active model of that tooth. Let's click Manipulate Model. And now when you hover on that tooth, the widget will pop up. You'll be able to rotate this around. And so when I'm doing this, I'm trying to get my cusp tips and my inclinations pretty much matched up along this arch. Okay, so when you look from the distal, you can set your cusp heights to roughly the same as what the tooth in front of it is. And then if we look at it from the top, to me this tooth looks like overall it's just too big. And so I'm going to make that tooth skinnier. So if you go to the arrow, that's your forward and back movement. But if you'll grab the little dot, that will squash the tooth in whatever direction you're moving that. Okay, so being a second molar, high stress area, in soft cancellous bone, I don't want to go too crazy with this and have a huge tooth. I'm going to make it a slightly smaller than normal tooth. And really it's up to you when you decide to work on the occlusion. You could do it at this stage. I could turn this on and I can just see just by looking that this is way too high of occlusion. So we might want to rotate this down, but certainly bodily bring the entire thing down. Okay, and you don't have to resolve every little bit. You know, just get it to where it's pretty close. All right. You can right-click models, turn the visibility on and off, but you're beginning to see this take shape now. We're impinging into this tooth quite a bit, so we need to pull that back slightly. There we go. And I want to look at the buccal area. You know, does it look like it's relating to this opposing model in the same way? We got about the same amount of gap over here, okay? And our occlusion is pretty close. So back in the teeth editing panel, I can turn off that manipulate model because we have the general positioning done on this tooth at this point. Now you do have the option, again, you can get as detailed as you want at this stage. If you feel like that's sticking out too far, you could certainly come in here with any tools such as the smooth tool, the add remove, the deforming tools, and we could do some cursory shaping on this. You'll also have the opportunity to do that later on, though, during the restoration design. It's personal preference. I just like to do a lot of it early on in the stage. Now, when I'm altering the occlusion, I'm going to turn this off. And sometimes when you're working on the occlusion, you would like to be able to see where those contacts are without having that model on. And there is a way to do that in your Teeth and Surfaces panel. You can turn on the closeness. And so what we're trying to evaluate is the closeness of this tooth down to its opposing model. Okay? And when you do that, now it's going to highlight with a color map. And basically with the intensity of color that you're seeing there, you know whether it's impinging. So now I can go back to the teeth editing panel, and you got a few options. You could just use a straight up add remove. You could maybe smooth this cusp. Okay, so this is in effect kind of what would happen over years of use. You know, it's just wearing the occlusion down, not in the grooves, but just up here on the cusps. The other tool I really like to use is the local transform tool. The local transform tool, for those of you who've used CEREC, this is very similar to some of the tools in that, but you've got your selector size, which you can change with the scroll ball. And by holding shift, it turns the tool on. So I can actually highlight a large area like this and drag it down, which minimizes the occlusal interferences, but it doesn't get rid of all my shapes. You can imagine if I just took that smooth tool and went through here smoothing everything, before long I've just got a blob of a tooth that doesn't really look very anatomical. So by using this tool, you'll be able to minimize those areas. And again, I'm not trying to get it 100% finished, because the software will also at a later stage cut those intersections if you have any. All right. So now you can see the proximity. The occlusion is pretty well done. We're not even going to have to really mess with that in the next step. So I think at this point, we've got the general global positioning right. We've got the occlusion somewhat right. We're ready to go ahead and design the restoration. So come to your restoration design panel. It's not open. Go to panels, restoration design. And let's go ahead and tell it what kind of crown we're making. So for this, it's not truly a crown. We're going to make a crown direct to the gingiva. So let's call it a conventional crown. We're building it on a maxilla. And then it's going to ask for specifically which model you want to build this on. So we're building it on the green model. Which tooth are you turning into the crown? Well, the one that we have here. It's the only option right now. And then your antagonist, you could do this without an antagonist, but you won't be able to dial in occlusion. Since we have it, let's go ahead and include that and then hit start. So at this step, it's asking us to define the margin. Now, this is not a true margin like you expect on a tooth with a crown prep. Here, we're just defining where on the gingiva we want this tooth to emerge from. And so it's not truly a margin, but we're going to hit the shift button and then go ahead and click our way around and define the emergence profile of this tooth. Okay, remember it is a smaller tooth, and so we don't need to go with a huge, like you would have on this first molar. That's also got this recession. So remember, we're doing a narrower tooth, so I'm going to just do that. This is your path of insertion. You can change it if you want to, but this really is not relevant to what we're doing here, so just click Next. Next, it's asking you to define the proximal area. So using your Shift tool, you can highlight and then left click, and all you want to do is just highlight where your proximal contact is, and that way the software will warp the contact down to the right shape and size. Click Next. And here again, this is where I was talking about you could do all of your tooth shaping later on in the process. I did this earlier. I got it most of the way there in the previous steps, but Honestly, you didn't even have to add the tooth back when I did. You could have just waited till this step and added a tooth here. Um, so you do have add, remove tools, smooth, local deform, all the things that you had previously. And if you need to make further modifications, do that now. If you've already done it, then you can simply click next here. And in this step, it's just designing the crown bottom. Again, this is not a true crown, right? We're not so much worried about um, cement gaps and all that kind of thing because we're just building it directly on our STL. So I'll skip this, just click next. And now what the software will do is warp that crown down to our gingival margin that we indicated. So you can see here. So the white that's shining through, that's your zero cement gap. Again, it builds it as if this were a typical crown. But we essentially have what we want at this point. All right, we've got a slight impingement here in the proximal contact. The last step here, you could do further modifications if you want, but we're going to tell it that we want to cut any occlusal intersections, anywhere that it's impinging through to this opposing model. And then we also want to cut the proximal intersections. So make a note of this contact here, and let's finalize this now. So now we finished the process of making the crown, and you see that it took care of the contacts and everything. If you go up to your surfaces panel, you're going to see here's the original crown. This is just the library tooth. Okay. And you can see some differences in contour and whatnot. But the tooth that we really want to do our crown down planning with is this custom crown. Okay. So this is the one with the correct gingival margins, the correct occlusion. Again, this would be more valuable in a tough occlusion case or in a multiple missing teeth case where you really got to be careful to get the teeth where they belong, or a high aesthetics case. This is none of those, but it's teaching the process. So with that done, we're ready to go to the implant planning. All right, so we just need to decide what type of implant we're placing. I'm going to do a BioMax 4.3 by 8. I'm guessing just because it's in the back of the maxilla. Actually, let's go with a 5 by 8 if it's possible. I like to put on a custom abutment simply because I want to see where the emergence position is. Okay, and I'll drop this into the pan window and just do my initial positioning, just get it in the ballpark. And at this point, I don't have much need of that opposing model anymore, so I can hide that. Remember, the crown has already been designed to the ideal occlusion and contours, and so now we can pretty much just plan with regards to the crown that we've proposed. All right, so every time I make a change, I'm monitoring how it's affecting the emergence position from that crown. So while this looks like it's good in the mesial to distal direction, if I look at it from a buccal or lingual, I need to get this implant straightened up and paralleling the adjacent teeth. And I'm probably going to bodily move it over just slightly. I always like to try and avoid putting a most distal tooth too far back. That's the tendency because you got all the room and you don't want to hit the adjacent root. But in my experience, the closer I'll place that to the adjacent tooth, the better I like the results. Okay, so you can see now we're getting a really nice emergence position. I might try to angle it just slightly more to get it out here towards the buccal. So if I look at this from a proximal view, I could just bodily move this entire crown over just a hair. And now you see I'm in the dead middle with my emergence position. The implant has plenty of bone. In fact, I could probably, if you're comfortable with manipulating the sinus, I could probably jump to a 5 by 10, which is a huge implant. That's a ton of titanium. Even in a second molar in a porous maxilla, I'm not terribly worried about that. There's a root tip to get out. That shouldn't affect things too much here. So I would probably plan on doing this with a very minor sinus bump. Wouldn't even use graft. I'd just breach the sinus floor. And that basically completes the crown down planning, okay? Because we designed the final crown, we've planned it with regard to the ideal restoration and gingival margins, and this is a lot more valuable. And again, you would notice this more in an anterior case, but a few of the things you can do, you can look, okay, the ideal gingival margin is right here. So you could actually play around with things like your abutment, and instead of custom, you could choose maybe a tie base. Okay, so let's go and find a tie base that would be appropriate here. All right, I like the regular tie base here. Let's see what that looks like. And you could go ahead and evaluate. Do I need this tie base? Do I need the higher emergence that flares up more before it goes out? Well, from the looks of this, I'm not terribly deep subcrestal. And if I just draw a line from here out to here, that's a really nice emergence, right? It's not going to have the tomato on a stick look. Same thing on this side. We can emerge very smoothly right out to this. Suppose that you were looking at this and it were going to have a tomato on a stick look. Well, that would be an indication for moving your implant maybe more apically, okay, getting a little subcrestal, and then maybe doing some bone profiling so that you can get that nice transition. Okay, but I'll move that back. I like where this is at now. And that's essentially it for the crown down planning. I'll go ahead and make the guide, and I'll show you one other trick. If you wanted to make a temporary ahead of time, then let's go ahead and do that. So I'm going to fast forward this part and just quickly make a guide. Okay, here's our surgical guide. So if we use this, and if we use that Blue Sky fully guided kit that we've chosen here, then we can say with near absolute confidence that that implant is going to be extremely close to this position. Okay, there should be no major deviations here if you've done everything fully guided. So we know the implant is going to end up there. Now, I wouldn't do this in this case. It's not aesthetic. It's not a necessary tooth. But imagine if you did have a case. Let's say you were doing a lateral incisor and you've done your crown down planning and you'd like to be able to immediate load that. Okay, so let's go ahead and do that. I'm going to hide the guide and I'm going to hide the tube again. So we've got a tie base on here. So if you wanted to make a screw retained crown, you could go ahead and plan on doing that. So stick a tie base on or whatever abutment you want to put on there. And at this point, if we wanted to, we could just jump back over to the crown and bridge module. And now that we know exactly where that implant's going to end up, we could design, instead of a tooth that goes to the gingiva, we could design a crown that goes straight to the tie base. Okay? So under restoration design, the first option is crown to a tie base on a maxilla. All of the same things apply. We need to tell it what our antagonist is. So that is the mandibular scan. The crown that we're going to turn into a restoration is this one. So everything's designated. Let's go ahead and click start. We're going to be able to buzz through this very quickly. Now my insertion axis, I want to coincide as closely as possible with the screw channel and with the distal contact of this tooth. Okay, so I'm going to alter that, look at it from all the directions and try to get it to coincide with your screw channel. All right, click next. Define the proximal area. Next. And you've still got to design a gingival emergence. Okay, that's what it's asking for here. I'm going to just use the same one from earlier, and what it'll do is everything above this gingival model, it's going to warp the crown down to that, and then everything below, underneath here, it's going to warp from this line down to the margin of the tie base. Okay, so keep in mind, when you're doing a tie base restoration, you're generally not going to have quite as big of an emergence profile as you would on a natural tooth, unless you've placed it pretty deep. So I'm going to click next. All right, and you see here the result. You've got the ability to warp this if you needed to. You could make the emergence fatter, skinnier, whatever you wanted to do. But that looks pretty good to me, so I'm not going to mess with it much. Maybe bring that out just a hair. And we do want to create a screw channel. Okay, so let's check that on and then just click next. And now you have a screw retained crown. And if this was just going to be an immediate load temporary or something like that, or something to train the gingiva, I would simply 3D print this. And then it's going to be dirt cheap. You're not going to have a lot of expense in it or any of that kind of thing. So this is a really nice option. And you do have the opportunity to work on your models again. So if you want to smooth anything up, then you could come in here, use any of these tools like that contact that's still a little bit high. Now you're not going to be able to alter a lot on the emergence profile here because that is an area that you designated earlier and the software knows not to mess with that. You know, the margin's going to be right here, so you wouldn't want the tools to be able to affect that. Okay, so it's really just this portion up here. That maybe looks a little bulbous on the buckle, so I'm going to just smooth that back slightly. And maybe the same over here. But that is our final crown. So we can finalize it by cutting the occlusal intersections and the proximal intersections. And now we have this as a final crown. Okay, so we could simply export this and 3D print it. So the only thing I want to export is that crown. Let's just put it in our downloads. All right. And then I could simply come over to my Sprint Ray printer. This is the Sprint Ray Pro. And grab that temporary and then pull it over into the build plate. Now I always try to print with the occlusion down and the screw hole basically facing straight up, which that looks pretty good. You can automatically base this with supports. And this is 1 milliliter of resin. It's virtually nothing, so I'm going to print a couple of them. That way, if there's a misprint or a patient breaks one, they lose one, whatever, it won't matter. But you would print this out. Now, I trust the accuracy of guided surgery, but I generally don't want to make it so precise that the final crown and everything and contacts are adjusted. Rather, what I would probably do is print this and remount the internal a little bit and then just leave it where that titanium base sticks up passively into this hole and then pick it up with a little cement. That's up to you. You can make this engaging if you want to and just have it already bonded on a tie base. You may have to adjust occlusion and contacts, but that's not a big deal. It's just personal preference. But the point is you can do a really, really effective crown down implant planning now with that crown and bridge module and be able to know with certainty that your implant is going right where it needs to be for that final restoration. So I hope you found that useful and hope you can make your planning even more improved on those complex cases.